Hi, everyone. Good morning, good afternoon, good evening. Thank you so much for joining us, depending on where you are in the world. My name is Tracy Toothaker. I'm the Director of Recruiting here at Worldwide Health Staff Solutions. I'm accompanied by my partner, Megan, and today we're going to be talking a little bit about one of our employers, Nashville General Hospital. So I'll turn it over to Megan in just a moment. Before I do that, I just wanted to say, please feel free to ask any questions in the chat, and we'll carve out some time at the end of the webinar today to address those. And then, of course, we would love to know where you are joining us from. So please add that into the chat as well. And Megan, I'll pass it to you.
Thank you so much, Tracy. Good morning. As Tracy said, my name is Megan Jenkins. I'm a recruiting coordinator here with Worldwide, and we are so excited to talk to you guys this morning about our featured employer, Nashville General. All right, so jumping right in, some of the requirements to interview for Nashville General, of course, they do require that you pass the NCLEX. They also require 2 years of current bedside experience working in the specialty that you would be interviewing for, and then also a diploma or a formal RN education in the program. Of course, with all of our opportunities here at Worldwide during the recruiting process, this will be a direct hire position. Working with your recruiter, they'll assist you in getting signed up for your interview, processing through the interview process, and all that good stuff. Throughout the immigration process, of course, most of our employers work with a EB3 visa. That'll be the same with Nashville General. Included in that EB3 visa, your immediate family members will be able to travel with you to the United States. They will also receive a green card after arrival here in the US, and they will be included at an additional cost. No English exam is required for processing. However, an English exam may be required in the state of Tennessee in order to obtain your license. And then you will receive reimbursement of the healthcare worker certificate, also known as the visa screen. You'll also receive reimbursement for the cost of your medical exam as well. Upon arrival in the U.S. or when arriving in the U.S., your employer will provide free airfare for you, the applicant, and then any additional costs for your family members, you will have to cover that. And then you will also be provided with at least 30 days of initial housing upon arrival here in the U.S. All right, so just a little bit more information about Nashville General. They are a not-for-profit hospital. They are publicly supported by the state of Tennessee, and they are located in Davidson County. They serve the greater Nashville area, and they, of course, provide accessible quality care to Nashville and the surrounding area. They have a main hospital, and then they also have a few surrounding clinics around the Nashville and Davidson area. And they serve a diverse population around Nashville, delivering all essential services to their population. They also have a dedicated team of physicians and staff they'd love for you to join. And they continue their mission to expand access, improve outcome, and provide compassion and equitable care for all of Nashville residents. All right, so just a little bit more about their mission. Their mission is to improve health and wellness of Nashville by providing equitable access to coordinated patient-centered care, supporting tomorrow's caregivers, and translating science into clinical practice. Their vision would be to be the leader in exceptional healthcare for all. Some of their values are compassion, honesty, accountability, respect, and teamwork. A little bit of by the numbers for Nashville General Hospital. They have 150 licensed beds. For their emergency department, they see about 27,000 patients per year. In their clinics, they see about 57,000 patients per year in their outpatient clinics. For procedures, they do about 300,000 procedures a year, and that includes all of their sites. So that will be their main hospital and also their outpatient clinics as well. This includes diagnostics, imaging, and their labs. And then they have 800 plus total staff members. And of course, like I said, they'd love for you to be one of them. All right. So just a little bit more about Nashville General and their requirements. Again, they require at least 2 years of current bedside experience plus a BSN. And then some of the benefits they offer is a $1,000 sign-on bonus, and then an additional $2,500 housing allowance. Or you could also select that 30 days of temporary housing, working with our relocation team. They have current openings in their NICU, the ICU, L&D, and also their forensics departments. So we'll be looking to start recruiting for those soon.
Thank you, Megan. Appreciate it. Okay, so now we're going to continue to talk about some of the other benefits of Nashville General. So the company benefits they provide are medical, dental, and vision insurance, retirement plan with employer contribution to your 401k. They do have a paid time off and paid holiday policy and plan that you can leverage. They provide and offer life and disability insurance. They also have a tuition reimbursement program. And then, of course, they offer shift and weekend differential pay, which varies depending on what your shift might look like. And so if that's something of interest to you, please feel free to reach out to your recruiter or apply directly so you can hear a little bit more about those. Okay, a little bit about Tennessee. So Nashville General Hospital is located in Nashville, Tennessee, but they have some surrounding areas that they can service and that are close to. And so here are some about Tennessee. And so they have charming small towns and also really fun, vibrant major cities. I've actually been to all three of these cities myself, Nashville, Knoxville, and Memphis, and can vouch for how beautiful they are. Nashville is booming, and it's become quite a major city and has really transformed over the last few years and has turned into a really great place to not only visit, but also live. They have rich music, arts, cultural heritage, great access to mountains, lakes, and scenic state parks. It's beautiful in Tennessee. Even just the trees, the foliage is really stunning as the seasons change. They also have excellent dining, world famous Nashville hot chicken and barbecue. I have had both and can say they are really, really good. Being from Charlotte, North Carolina, where Megan and I are located right now, we've got some pretty good barbecue, but I will say Nashville gives us a run for our money. They've got great barbecue too. They have family-friendly communities. Cost of living is pretty low, and they're centrally located with easy travel across the Southeast. They're also known for friendly people and true Southern hospitality, which I experienced that also during my time, especially in Nashville. So some quick stats about the state, just over 7 million in population. The median age is 38. Average commute time is 26 minutes with a median home price of $390,000, which is really good, especially, again, just even in comparison to Charlotte, North Carolina, which is a couple states over, not far at all. Ours is a little higher than that, so that's definitely affordable. Average and low temperatures are, on the high side around 89 degrees Fahrenheit during the summer months. And then, right around this time, probably in the next couple of months, they'll start to hover around that 28 degrees Fahrenheit temperature. They get about 51 inches of average rainfall per year. And then their average monthly rent is about $1,600. A great price point from a rental perspective. And that's pretty affordable cost of living, especially with, the access to all of the various things I just mentioned a moment ago. And then their primary major airport out of Nashville is B&A. And I have flown into that airport, and there definitely is a lot of opportunities and connecting flights to get where you need to go throughout the rest of the country or internationally. Okay, so here is a little bit of a cost of living comparison. So you can see the figures on the left are for the Nashville area and surrounding counties, whereas on the right, this is what it would compare to in, say, a San Francisco, which is a large, dense metropolitan area on the West Coast. Housing, big swing. You're paying around that $1,600, where it's more than double for somewhere in San Francisco. Food, childcare, transportation, healthcare, all hovering around that $1,000 to $1,500 a month total. And then, totaling up annually for total cost of living expenses, around $102,000, whereas, San Francisco is north of 211, 215. So definitely an affordable area, affordable city, and a growing city, not only just in Nashville, but, Franklin, for example, has also been growing. And so definitely affordable considering the growth. Okay. As Megan mentioned before, some of the units that we're going to be hiring for, we will have interview dates very, very soon. We're working with the Nashville General team to secure those and anticipate having those in the next coming days. So please be sure to either apply directly to our website or reach out to your recruiter if you are interested in these opportunities. And of course, we have our worldwide guide fully launched, and that's the best way to follow along with any new opportunities. And then, of course, your recruiter can keep you posted on when we might have some of those dates posted in our worldwide guide to schedule for. Okay, so thank you so much, for tuning in for a little bit of info on Nashville General. We would love to answer any questions that you have. I see we've got some activity here in the chat. So if you have other questions, please let us know and we will get to them. We also have live recruiters standing by. If you want to follow this link, healthstaff.org live chat, you can connect with our recruiters directly to get immediate answers to your questions. But we'll go ahead and take a look here and see. Looks like we've got some folks joining from Ireland, Saudi Arabia, South Africa, Kenya, Nigeria. Amazing. South Africa again. Nigeria. Awesome. Thank you all so much for joining. We've got representation from all over. Love to see it. That's great. Perfect. Okay, let's see if we've got some questions here. Question about med tech opportunities. So for these opportunities with Nashville General at the moment, they are RN EB3 opportunities, but we would love to help talk to you a little bit about what any future med tech roles that we have available. So would love for you to apply directly and we can help direct you about those. Awesome. A question about, we are working with Nashville General at the moment for their ER opportunities. We do have some needs in that unit, so would love to talk to you about those. Igamula, if you want to apply directly, and we would be happy to assist. How long does it take for the process? Yeah, great question, Ravi. So from the time of interview to offer accepting to petition filing, right now in the times that just with retrogression and processing, we're looking at a minimum of about 24 months, somewhere between the 24 to 36 month total time frame to process and immigrate here to the United States. Faith, looks like you've applied. We have not responded. So sorry about that. We would love to get in touch. Yeah, definitely feel free to reach out directly to us. I know we've added some links in the chat so far today for you to reapply, or you can chat with our live recruiters and they can make sure that we get in touch with you. Grateful. And yeah, so grateful. These are EB3 opportunities, RN EB3 roles. So yes, we can provide an EB3 for you. Dante, yes, we do. We have a sign-on bonus. It's a $1,000 sign-on bonus for Nashville General. Good questions. While we're waiting for some other questions to come through, wanted to also encourage you all to follow us along on our social media platforms and to refer any nurses that you might have in mind. If you're already working with us, please feel free to follow the link that we'll add in the chat. You can earn $250 for every nurse that you refer. And, if you're already working with us, we would love for you, again, to just follow along with the other posts that we have out there about different opportunities and just what's going on with visa processing. And so feel free to follow us on Facebook and Instagram, like us on those channels, and subscribe to our YouTube channel. This is where we post content just like we're sharing today, among other things. So would love to get in touch and connect with you all that way. Good questions coming in, Robbie. It looks like question maybe about total years of experience counted. We do base years of experience off of a full-time capacity with at least 2 years of experience in the specialty in which you would be interviewing for. Gladys, great question about the bed capacity of their ICU. We can answer that for you. I don't know, Megan, if you know that off the top of your head. I don't either, but happy to get that information.
I don't have it off the top of my head, but if you definitely follow up with your recruiter, we can get that information for you.
Absolutely. Yeah. We have opportunities for long-term care units. Absolutely. For Nashville General in particular, that's not something they're hiring for at this moment, but we have other employers that have needs on a long-term care unit. So we'd be happy to talk to you. Question about pharmacy assistant or healthcare assistant. We are not currently hiring in that capacity at this time, but Sheila, we would love to stay in touch with you to talk about what opportunities might look like in the future. So please feel free to apply directly. Couple questions about minimum pay and rates. That, obviously that varies vastly between employer and years of experience. So it is a case-by-case basis. We would love to talk to you a little bit more about what that looks like. And, and obviously once you interview and have your total years of experience calculated for an offer, that's when you'll have a formalized offer with an hourly wage tied to it. But happy to talk to you about that process.
It looks like we also had a question about H-1Bs.
Oh, yes. Thank you so much. Yes. So good question. We currently we don't have any opportunities for sponsoring or allowing H-1B sponsorship at the moment. We are very much anticipating to have some additional information about those opportunities, though, and some updates about our recent proclamation. So we would love to stay in touch with you as we keep a very close eye on our chance to work on those types of opportunities for H-1B sponsorship in the future. Narna, great question. If you have an existing priority date, we would love to speak with you. We have plenty of employers that are very interested in assisting nurses that might have an existing priority date. So please feel free to apply directly on our website. We'll make sure someone reaches out to you. Mohammed, good question about the type of surgeries they perform. It ranges widely. They absolutely have. I believe they're a level 3 trauma center too, so they see quite a bit of just varying cases, and we would love to get you some more specific information about their average nurses the average surgeries that they perform. Happy to share that. Sheila, yes, you can apply directly to, I believe our host has added in the chat a link to apply, and we would love to hear from you, so please do. Mohammed, good question. I believe you're asking about I'll answer it in two different ways. One, while you are working on immigrating here to the United States, we have a clinical team that helps with making sure that your transition to the United States, both from an education standpoint and practice standpoint, transition very well. And so we have several different resources that will help you through your transition once you accept an offer. And then, of course, once you are here in the United States and working with your employer, they will orient you accordingly to their Unit 2. So you'll receive lots of training, lots of education and support as you join. Great questions. Megan, do you see anything that I'm missing?
I think the only one was from Moses, who said he hasn't taken the NCLEX yet, but can he still apply?
Great question, Moses. And yes, so you do for any of our opportunities, the minimum requirement is that you have passed the NCLEX, and so hopefully that will be something you're able to obtain in the very near future. And once you do, we would be happy to help. Okay, yep, another great question from Ravi. So the contract duration, the contract that you would sign if an offer is received is for 36 months. But you are a full-time direct employee of the hospital. Your commitment is 36 months, however. And then depends if there are some states here in the United States that are a part of the compact license program. And so depending on where the state is, that could translate from a licensure standpoint. But it all just depends. So we're happy to talk to you about that and help you through that process. These are great questions. Yes, premium processing for a current priority date. Absolutely. We do that. That's a good question. Happy to work with you on that and talk through what that looks like. Hester has a question about hemodialysis at this particular hospital. And while they do have a lab environment, we're not currently hiring for any of their lab roles or lab units. So while they don't have any of those opportunities we're hiring for at this time. Good question, Gladys, about if you have your NCLEX but don't have any hospital experience yet. The NCLEX is step one, and then yes, having at least 2 years of bedside nursing experience is step two. So, if you are working on gaining some of that experience or are close to it, still please apply, especially just because of the immigration timelines. We, can help work with you on what a plan might look like long term for you to plan your interview accordingly. And a question from Sheila. For the Nashville General opportunities, they are bedside RN opportunities, but we do support and help various clinicians. So if you're interested in a separate path, we would be happy to talk through what that looks like and at least share some options and tell you about what we might be able to do to help. Ravi had a question about safe to live and work and in Nashville. Absolutely. Very, very safe area, especially, keep in mind, Nashville is a metropolitan area. It is a dense city. And of course, in any of the more densely populated cities, some of those levels may vary. However, absolutely safe. Like I've mentioned, I've visited several times and felt very safe. And, we work with the folks at Nashville General very closely, and they have echoed the same. So definitely a safe place. And Anil, these are EB3 opportunities. And Narda, yep, we sure do. We have opportunities for the OR as well. These are really great questions. Thank you so much, everyone.
Absolutely.
Okay. Yeah, another great question. Yep, absolutely, Ravi. If your spouse is also a nurse and qualifies based off of what we've covered today, 100%. We would love to help you both obtain employment at the same hospital. All right. Perfect. Well, thank you all so very much for tuning in. Megan, thank you so much for your time this morning. Megan works directly with Nashville General, so she was our SME, our subject matter expert today. And thanks everyone for all of the great questions. We look forward to connecting with you again in the future. And please feel free to reach out if you have any other questions.